evening, everybody. This is Dr. Satyaki Bardhan from Kolkata. I am a general physician in Lansdowne area, and I'm also attached to Woodlands Multi-Speciality Hospital. Today, I have been given the opportunity to discuss a very common problem in the society, that is hypertension, high blood pressure. One of the very common medical issues that is happening these days in every family, and we are very much concerned about it because hypertension, if not treated correctly and initially, can slowly bring lot of high risk situations, compromising our heart, our kidneys, liver, and brain also. So today I'll discuss few basic points regarding hypertension and how we can be more aware to control it. Generally, everyone would like to have a healthy or normal blood pressure, but what exactly hypertension means is the blood pressure, if it goes above 140 and 90 diastolic, then we call it hypertension. Whenever the blood flows through the blood vessels, it creates a lateral pressure to the system. That is blood pressure. Generally, the body has an ability to modulate the pressure and keep it at a normal values around 120/80. But when pathology occurs, then you can get a high blood pressure of more than 140 and 90. Now, there are a lot of risk factors which actually increases the risk of developing hypertension, like age. As we go older, the blood vessels get stiffened and narrowed because of the fat deposition, and hypertension can develop. People who have hypertension in their families are more prone to develop hypertension. Dietary salt intake, if it is more, that also predisposes high blood pressure. Foods which are not containing good amount of potassium can also have a risk factor of increasing blood pressure and eventually can also increase the risk of stroke and chronic kidney disease. Eating processed food and fatty foods which increases fats in the body, that also increases high blood pressure. Moving on, hypertension does not have any obvious signs and symptoms. That is why it is often called a silent killer. An early and accurate diagnosis is very important in the management of hypertension. Measuring the blood pressure is the only way to know whether the person is having high blood pressure or not. If the blood pressure level is more than 140/90, the person is called hypertensive. As hypertension is very common, we are celebrating a particular day on May 17th as World Hypertension Day, a day dedicated to highlight the importance of monitoring blood pressure and bringing global awareness to 1 billion people living with high blood pressure worldwide. The theme of this year's World Hypertension Day is to measure your blood pressure, control it, and live longer. That is why we have to aware the general population that we have to monitor blood pressure and we have to keep ourselves healthy. We can control blood pressure by following some basic lifestyle modification: regular exercise, healthy diet, smoking, quitting alcohol intake, regular blood pressure monitoring, so that we can be aware that early rise of blood pressure, stress management, and adherence to medicine. Regular exercise and physical activity generally causes heart stronger. A strong heart and a healthy heart can pump more blood with less effort. That also reduces the blood pressure. A healthy diet means a diet with grains, fruits, vegetables, low fat dairy products, low saturated fats and total fat, plenty of potassium in diet. These increases the benefits to control blood pressure. Even a small reduction in the sodium in the diet can improve heart healthy and reduce the blood pressure by about 5 millimeters to 6 millimeters of mercury. If you have high blood pressure, to decrease the sodium in your diet, we can have low sodium containing fruits. We have to avoid added salt in our diet. 1 tablespoon of salt contains 2300 milligram of sodium. So if we can just avoid that, we can also control blood pressure. Stopping of smoking helps your blood pressure to return to normal. Quitting smoking can effectively reduce your risk of heart disease and improve your health. Regular blood pressure monitoring can also keep us aware of our blood pressure, and we can detect early blood pressure rise and can take necessary action. By learning how to relax and manage stress can improve emotional and physical health and also lowers the high blood pressure. Once we are detected with hypertension, we have to be adhered to the medicine so that our blood pressure remains under control. A medicine to lower blood pressure can be recommended by a doctor. Is you need to adhere to the medicine. If it controls the blood pressure with the medicine, you need to just continue with without the prescription of doctor. Don't discontinue or alter the dosage of the medicine. I'd like to suggest that there is nothing more precious than having a fit and healthy life. Adopting healthy lifestyle can help us to enjoy long and healthy life. High blood pressure can be prevented as well as controlled in many ways. Keeping blood pressure in the normal range is very important and in preventing cardiovascular complications. It is very much possible to maintain normal blood pressure level with regular monitoring and preventive care. If we can control blood pressure, we can also control our heart, our kidneys, and we can also reduce the risk of stroke. So on the day of World Hypertension Day, we have to be more cautious about hypertension. We have to follow a healthy life by controlling our blood pressure. Thank you very much.